represent the Democratic Party of Georgia at this event. You know, having listened to this debate just a moment ago, I'm all fired up. I don't know why we're going to wait for another 6 months. I can do it right now. I don't need any other Democratic candidates. I'll take all 6 of them, all 7 of them, right now. Well, my name is Branko Radulacki. It's Dr. Branko Radulacki. And with a last name like mine, you might think that I'm from a South Georgia family. Well, certainly that's not the case. I was born in the former Yugoslavia in Belgrade, moved to the United States at the age of 7. I've been happily married for over 20 years, and I have 2 teenage children. A daughter, Katie, who's a junior in high school and just took her SAT last weekend, and a son, Ryan, who's 15 years old and he's a freshman. So they keep us plenty busy, notwithstanding the current campaign. Now, as a psychiatrist, a medical doctor and a psychiatrist, when I come to public settings similar to this, a lot of times people take a step back and they sort of they wonder, gosh, he's a psychiatrist. I wonder if he's analyzing me. And I just want to assure you, I'm not here to analyze anyone. I can barely see you with all these lights. But I am called to go and to analyze and address the dysfunction that's been plaguing our country up in Washington. And I've started my public service, as Mike mentioned, doing mental health advocacy around reforms for state psychiatric hospital systems here. At that time, several years ago, there was a crisis and over 100 people were documented to have died under suspicious circumstances in those hospitals. Now, I helped galvanize a group of mental health advocates after our state government did not respond positively to that crisis. I helped galvanize mental health advocates, including the Carter Center, to address that problem. And our efforts resulted in the United States Justice Department getting involved and suing the state of Georgia regarding those reforms. 2 years later, the state of Georgia agreed to a settlement with the United States Justice Department for $50 million. And that was a wonderful outcome. And it taught me 2 things, at least 2 things. One is that one person can make a difference in standing up for the vulnerable and those in need and helping fix an institution, a process that was so broken people had given up on. That's number one. Number 2 is that there is a role for good and effective government, even federal government. Yes, local, state, and federal government. But we need the right people to galvanize and channel the resources of that government in the right areas. Now, when that $50 million, that settlement came through, where did those resources go? They went to communities like yours to help address community resources, provide the kind of treatment and care that those individuals needed, that the most vulnerable in our society needed. Now, even before going into medicine, I worked at Wall Street as an investment banker and then earned my MBA from the University of Chicago. So I really believe that my background in finance and in healthcare and running a small business as a solo practitioner, as well as my mental health advocacy work, has really equipped me to be a strong and effective voice for all of Georgia up in D.C. and to help end the gridlock that's been plaguing our nation for the past few years. And I want to talk a little bit about some of the issues and policies of my platform that will resonate with some of you, and also talk about the opportunities and the way I plan to advocate for you up in the Capitol as well. As a medical practitioner, I do believe in healthcare reform. I believe in providing affordable and accessible healthcare to as many Georgians and as many of our fellow Americans as possible. I do support the legislation, the Affordable Care Act. Not that it's perfect, not that it doesn't need changing, which it does, and we should make those changes. But we should stop wasting our energy looking back. Instead, we should focus on moving forward and making those fixes. And I also believe in Medicaid expansion. I believe in economic argument and moral argument for that. And I believe that's one of the biggest issues facing Georgia in 2014 that we need to address, and we do need to expand Medicaid. I also believe in immigration reform. I believe that as a first-generation immigrant, I've benefited from the opportunities that this great country has to offer. And I know that there are others around the world who still look at America as a land of opportunity. And it is. And we need to maintain that. And we need to create opportunities for those individuals who are willing to come here, willing to work hard, pay taxes, and I believe we would benefit from their industriousness. The President of the United States Chamber of Commerce recently said that immigration reform is a top issue for his group. And I agree. Now, we heard just a moment ago some of the other candidates talked about immigration reform and amnesty. Well, you know what? the Senate passed a bipartisan bill. So I believe that amnesty is one of those things, it is a red herring, because the Senate passed a bipartisan bill. Why can't the House do that? I'll tell you why. Because there's dysfunction up in Washington. That is the issue, and that we need to address. The other issue I want to talk about is education reform. Whenever the pathway that I've chosen and the pathway that's led to the success that I experienced, it's been through education. When I've made mistakes in my career, made bad choices, I've turned to education as something to get me out of it. So I believe that education is the social ladder of mobility in our country. And we need to make that as affordable and accessible as we can as well. Now, with respect to some of the issues that your group, that the GMA is facing, I want to let you know that I'm a strong supporter of many of those issues. For instance, I do believe that state and local government should be able to levy taxes on remote sales. I believe that that is one of the roles of the federal government, is to create opportunity and also level the playing field. And I believe also, and I would be supportive of continuing the tax exemption for municipal bonds. I understand how difficult it is to raise capital and how important that funding source is for communities like yours. And we need to have that continue, because that is going to be part of the engine of growth for your communities and job creation. And who knows better how to deploy those resources than you all. I also believe in transportation policy and telecommunications policies that would channel investment in the infrastructure that you all need to be competitive, not only in your local communities, but at the state level, in our country, and globally. And I also believe that telecommunication policy needs to have more local and regulatory control, letting you decide what's best for your communities. So how do we accomplish this? How do we accomplish all your legislative goals and objectives? Well, you're going to need an advocate who has both vision, the skills, and the courage to advocate effectively for you up in Washington. Because you're going to need someone to be able to break through to that dysfunction that's been going on. Now, I've done that as an advocate for my practice, for my patients and their families. I've also done that for those who are most vulnerable in our society under the state's care in the state psychiatric hospital system, and I will do it for you and your communities. Now, as I've been saying on the campaign trail, people have been telling me, Georgia does need a new senator, but Washington really needs a psychiatrist. So on that count, I'm ready. I'm ready to be your next Georgia senator. I ask for your support, and I ask for your vote in May and again in the general election. Thank you for this time.
We appreciate